The content of this podcast is personal opinion of the hosts and guests and is not to be taken, interpreted, or perceived as medical advice on the practice of medicine.
Hi, welcome to the Aesthetic Podcast. I am your host, Aesthetic Ann, RN-CANS.
And I am your other host, Sarah. Welcome back.
Hello. Today we have a really cool topic. I love this topic.
It's the booty topic.
It's the booty. You know, remember Beauty and the Beast?
Yes.
You couldn't say beauty when you were a toddler. And
I didn't want to say beauty. I wanted to say Booty and the Beast.
Oh, you did not. You couldn't pronounce beauty. It was like booty.
Booty and the Beast. So you're talking about booty stuff.
Yeah, not the beast. But we're talking about sometimes some of these booties can be beasts, though.
Mm-hmm.
They can actually, yeah, there's some big ones out there.
So we're talking about non-surgical butt augmentations.
Correct.
And we have a specialist with us today, a special guest to talk all things booty.
That's right.
So introduce her to us.
I will. Sounds like a great idea. Melissa Gibbons is an RN BSN, and she actually is working on her FNP. That's Family Nurse Practitioner degree.
Ooh.
Yes, she's been working on it for a while, working really hard. She's out of Houston and owns Skinscriptions by Melissa Gibbons. She's been in the aesthetic business for 20 years, and she's been a trainer for some of the different companies, aesthetic companies and device companies for about 15 years. Currently, she is training with Mertz, and they make Xeomin, which is another neurotoxin, and they make Radius, which is a type of filler. And Radius happens to be used in the booty to make it bigger. So we're going to talk about that. Hi, Melissa. How you doing?
Hello, everyone. I'm doing well. Thanks for having me.
Well, thank you for being on. I also failed to mention you are president of the Texas Aesthetic Nurse Coalition, TANC, that we are on the board together.
I am. Woot woot, for sure.
And I would also just like to point out that you are friends with Ann because about 90% of the time she's on the phone, it's with you. That's what I found in our personal time. So you guys are besties. You, tell me how y'all met.
So we actually met through the whole, I guess, issue with Texas Medical Board and 193, after 193.17, but I guess in 2000, was it 16, Ann? 2013.
13, yeah.
Yeah, when they started the Texas Medical Board, and I don't know really at all, I guess I shall say, just tries to change the nursing scope of practice just for aesthetics in Texas, which is really kind of crazy, but it's very discriminatory against women, number one, and nursing as a profession, and aesthetic nursing as a third thing. So, some of those things you just have to stand up and fight against. And so that's where we joined forces and started collaborating and joined the Texas Aesthetic Nurse Coalition, because women in aesthetics who are nurses do need someone that stands up and says, but you cannot carve out this part of nursing and not carve out any other part of nursing. If I can save your booty, no pun intended, in ICU, then I should be legally allowed to do your Botox or give you a bigger booty. Can I get a hell yeah?
Hell yeah!
I love it. Y'all are two peas in a pod.
Yeah, well, I always say on those nursing injector groups or like other Facebook groups or whatever, when this comes up, I'm like, yeah, you don't mess with Texas women. You're just not going to do it.
True that.
So today's topic, as I mentioned, is butt augmentation. And I want to give a little bit of history real quick. So butt augmentation kind of started out with more like implants. Do y'all remember 10, 12 years ago, there was the rumors that, Kim Kardashian had butt implants done.
Mm-hmm.
Yeah.
Yes.
So
that's surgical.
Right. That's surgical.
We're not saying she had them. We're just, don't cease and desist us, Kim Kardashian West. We're just saying that was
rumor.
alleged And the allegations were that it was surgical implantations.
Right. And I was literally about to say, I have no idea whether or not she had any kind of surgical implants, but I just remember that was like the big deal.
Mm-hmm.
And implants kind of went out of favor because they're not very comfortable. I mean, it's like sitting on two hard balloons, basically. They're just not comfortable.
But the desire for big butts has not subsided yet.
That has not gone away. And so then the next step was taking fat from other areas of your body and injecting it into the booty to make it bigger, which sounds like a great idea. And it has been pretty successful, but it is very difficult. And it became one of the most high-risk plastic surgery, elective plastic surgeries done because, it just had the ability to have a lot of complications, mostly because you've got your sciatic nerve going down there, going along that leg and, into the gluteus. And I don't know the whole anatomy because I don't work on butts. But anyway, so if there's a plastic surgeon that happens to be listening, forgive me. All I know is that a lot of plastic surgeons began having a lot of complications. And there's a condition called foot drop. And so some people, and foot drop can last temporarily. It can be permanent, but basically it's like where you literally can't, lift your foot.
From like nerve damage?
Yes.
Yikes.
Yes. So, and then sometimes they could, that could happen from just putting too much in there, and the pressure, can cause that to happen. So, Brazilian butt lift is still really, really popular, but what's growing in popularity?
Wait, is Brazilian butt lift fat injections?
Yes.
Okay.
Yes.
Sorry, what's growing in popularity?
So what's growing in popularity is the non-surgical butt lift, or, booty shaping and all that kind of thing. And there's several different ways that it can be done.
Okay, so let's talk about that. Missy's going to tell us some of those different ways.
Yes. So Missy's the expert. And now I do know that some of the injectables that we use, one is Sculptra that's made by Galderma, and the other one is Radius made by Merz. And she does use both of them. So Missy, tell us a little bit about those two products, and is there one that you like better than the other?
So first of all, there's two different reasons people kind of do butt lifts, or actually three. The first would be to get rid of what we call the hip dip. So it's an athletic build in the buttocks that seems to be undesirable in women because when you're wearing a dress that's contoured, they want that hourglass shape, which some of the movie stars have made very desirable. And so no longer Twiggy is in. We want wide hips, and so it gets rid of that hip dip. That's one reason people do kind of want filler in their butts. Another reason that people might want filler in their butts is in that lateral edge of their booty, if they want more of a bubble butt per se. We can do that. We can use fillers to do to help with the gluteal sagging and contouring. And another thing we can use it for is just irregularities. So cellulite, striae, things like that. So stretch marks, dimples, and a lot of times just elasticity. Sometimes people think it's cellulite, but it's just elasticity. So we can use it to volumize, we can use it to shape, and we can use it to contour.
That's pretty killer. That sounds very interesting. And I've seen a lot of this on Instagram, and I know that was a pun. I've seen a lot of it on Instagram, but did you get that?
Got it. Gotcha.
Okay. However, and I do get how this is done, but I haven't done it myself, and I haven't gone to training. It's something I would like to do. So kind of explain to us how this builds these areas over time. And like I said, which product line do you like using, or do you use the different product lines for different purposes?
It really just depends on the patient. So it's not one of those things where you can say, I like to use X for lips, because it's the same thing for booties. I like to use X for booties, this type of booty, or Y for this type of booty, or Z for this type of booty, depending on what we have going on. So I guess that's kind of the different categories we need to drop this into. But if I had a patient in my office, and let's just say she didn't have a butt and she wanted more volume in her butt, then I would probably reach for either Sculptra or hyperdiluted Radius. And what that's going to do, they're both biostimulators, but they're going to build collagen over time. So we put large volumes, like 50, 60 cc's in per butt cheek, and to give them more of a bubble pop or bubble booty or bubble butt. And then that goes down a little bit after the initial injection, depending on which one you do. Sculptra tends to go down more in volume. Radius tends to kind of maintain the volume, but it depends on how much volume we need. Number one, kind of how the skin presents itself, whether it's thinner skin or it's thicker skin, or if they have more stretch marks, or they have laxity and dimpling. So we can really customize it and contour. And sometimes I'll layer the two products together. So it really depends on how much volume, where, what the tissue integrity looks like, and where they need the lift. So that kind of tells me which products I'm going to use, what technique I'm going to use is to get the lift that I want, and then is anything additionally done. So sometimes we'll build the area out first because it's kind of the raisin versus the grape, right? Mm-hmm. And then we'll come in and we'll fine tune, or I call it, the sandpaper. We'll come in and we'll kind of fill the divots if there's anything that needs to be fine tuned or smoothed out once we volumize. Some patients just come in and they think they have cellulite, and they don't have cellulite. They just have laxity. And then that situation, we would use Radiesse instead of Sculptra to kind of help with the laxity in that area. Or if someone, thinks they have cellulite, but they just not enough volume, then we would use Sculptra. And then there's a whole new thing, out there that we're going to talk about later on that is just to address cellulite specifically. So there's a lot of, confusion when women look at their legs or their butt as to what's cellulite versus what's the laxity, if that makes sense. And so during the consultation,
totally.
there's a way to tell what is what. And so, we can educate the patient and go, this is really not cellulite. And this is a test that we do. We literally do the physical test to show this is cellulite, this is laxity. And that kind of shows the patient why we're choosing to take course A, B, or C.
Gotcha.
If that makes sense.
Oh, yeah, totally. So the big question is, do you have something, Sarah? You have this look and you're like leaning towards the microphone.
I do have a question. I have a question about time. So if I were to go get my lips filled, it's, usually like half a syringe, 3/4 of a syringe, 45 minutes in the office, and I have instant results. But what is the time commitment, I guess you could say, for getting the butt that I want? Is it one treatment? Is it several treatments over several months? Kind of talk about what that looks like in having realistic expectations.
You read my mind. That's what I was going to ask.
Oh my gosh, we're so in sync.
So both of them are not going to be one treatment. It's multiple treatments depending on the patient's expectations. Obviously, when we're using any sort of biostimulator, it's 2 to 3 sessions, sometimes even 4. And that just depends on what the patient's trying to accomplish. And so because we are building and stimulating that collagen, it's not just one session. Now, will you have results after that one session? Absolutely. But that's going to kind of go down a little bit. And so also you're going to have some bruising. So if a patient's trying to get a big butt because they're going, to be with their girlfriends for a weekend, that's not really kind of one of those things that we're going to do, because they're going to have some bruising that is involved with in any of these injections. So it's not a temporary thing. It's more of a long-term thing. But can I get someone to look good in a bathing suit in 4 to 6 weeks or better than they look today? Absolutely, I can. But will they look even better if they come back in 2 months and have another session and then another session to layer and stimulate that collagen? Absolutely. And then the results are going to last a little bit longer. So, I think that the expectation is a little bit different than lips, because this is a biostimulator and we don't do a biostimulator in the lips per se. Time in office, about the same. It's about 45 minutes. We use a large cannula. You don't have a lot of feeling in the butt, so it's very comfortable. We do numbing at the sites of injection that we're going to be placing the cannula, because we do not use a needle in the butt. And I have some patients that literally want to take a nap. They just don't feel much of anything in the plane of tissue that we're putting the volume in. So now if we're doing cellulite dimples, it's a little bit more superficial, and depending on what we're using, it can be a little bit more intense of a treatment, but still 45 minutes to an hour, you're out of the office.
Yeah. Awesome.
We want to take a moment to say thank you to the sponsor of this episode, Schroeder Coverage. How much of your business is made up of aesthetic and cosmetic medical procedures? Technology and innovation often work faster than the laws governing them and protecting you.
Traditional malpractice insurance often does not extend to new and innovative procedures in the aesthetic industry, but don't wait until you have a problem to find that out. Endorsed by Cellular Medicine Association and the same insurance that Aesthetic Ann uses, Schroeder Coverage and their Meta Coverage has a plan that covers all the procedures you perform. You know that your patients are in good hands. Make sure that your practice is in good hands as well. As a listener of this podcast, you can get special access to Meta Coverage's plans tailored to the procedures you perform today so that you can keep innovating to bring your clients and patients the best experience tomorrow. Contact James Schroeder at Schroeder Coverage to schedule a personal consultation. James can be reached at 440-617-9010 or aestheticmalepracticeinsurance.com. All that info is in the description below. Thanks for sponsoring us.
All right. So when people have this done, is it like in plastic surgery when they have, when they have the fat injections, they can't sit on their butt for a while. They have to they have to be on their stomach and
For
up in the air
weeks.
on a wedge for several weeks. And then usually they get around to a donut. So what do they do with this?
So I think that might, and I don't know because I'm not a plastic surgeon, but I think that's more to not damage the fat cells if they've been transferred and they're
Right.
kind of in an altered state, right? So with filler is not alive. So filler is just there as a holding place or a lattice work. And then over time, the gel carrier goes away and is resorbed in the body in about 90 days with, let's say, Radius per se. And at about the time the gel carrier or the sodium carboxymethylcellulose gel is designed to go away, then your body then builds new collagen scaffolding around that. So they don't have to baby it per se. I mean, they can go on about their normal activities. We wouldn't want them getting in a hot tub or anything like that for the first couple of days just because of bruising and infection and things like that. But we don't tell a person that they can't, sit down or lay down or drive themselves home or anything like that. Not at all.
Yeah.
That's great.
Awesome. Cool.
That's awesome. Pretty much no downtime.
Yeah, pretty much, except the bruising. So, but you can wear
there's
jeans.
bruising. Yeah, I mean, that's bruise, man. They do. And I think it's as long as you set that patient expectation. I mean, I've had mine done twice. I adore it. I love it. I've only had Sculptra in my booty, and I've had.
I was going to ask that. Tell us about your butt.
Well, I have the hip dip, so I have a hip dip, and I just don't have much of a projection in my booty. So, we always want what we can't have. But anyway, so I've done it for the hip dip primarily, and to give me just a little bit more of a bubble butt. Now my MA, I've done only Radius on her. Actually, no, I'm lying. We did Radius and we've done Sculptra because we wanted to kind of see which one did better for skin integrity. And really shockingly to me and to her as well, because we did a measure for both of us. And then we had our staff look at results from both and which one they thought looked better. And Radius did better with skin integrity than Sculptra, which was actually kind of backwards as to what I had anticipated, honestly.
Yeah, that's not what I would have thought at all.
Nope. And that's what they say. And, we have all these studies from during surgery and all these things, but I just wanted to see, to treat that irregularities and the skin integrity, what would it do? And actually even help some of the stretch marks. So I was shocked to see that Radius did better and different, layers. We're going to dilute more the deeper we are in the tissue, and we're going to dilute less the closer we are to the surface of the skin because we want those calcium hydroxylapatite molecules to be closer together. And so, it's thicker on top and thinner on the bottom, which is also kind of backwards to what one would think as far as volume is concerned. But Radius does a really good job for skin integrity.
I totally would have not thought that too. Because
right? It's totally backwards.
Yeah, because with Radius in the face, we want to put it deep. And then if we're going to, go a little bit more not superficial, but, a different layer, a little up, kind of thin it out. So that's kind of
right. So if we do 5-to-1 ratio deeper for volume, and then the closer we get to that epidermis or that middermal layer or that junction, we're doing a 1-to-2. So
how does it not cause nodules?
Opposite that you would think.
When you do that 1-to-2 in that dermis epidermal junction, how does it not cause nodules?
Same reason it doesn't cause it in the face.
That's just.
You just don't get. It's an injection technique. If you inject it into balls and blebs, you'll get balls and blebs. Mm-hmm. But if you inject it with a cannula and you inject it cross-hatched in the right plane of tissue and in a straight line, and not like say the lollipop or the dotted line, then you get a nice smooth result. I mean, it just does a really nice job, which was really opposite to what we thought going into it. I thought, oh, you know, I'm such a Sculptra like lover in the butt. No one was going to ever turn my brain around to think something differently, especially dealing with something that's thicker, right? I was like, how is this going to work?
Exactly.
But it actually was, it's great.
That's cool.
It's great.
Okay, so let's talk pricing. What can we expect? Ballpark estimations. What are we looking at for wanting to go from like a 2 to a 10 butt?
So it's about $10,000. I mean, it's expensive. You use 10 syringes or 15 syringes on your first session. It's a lot of money. I would probably use, let's say, 7-8 vials of Sculptra, 10 to 15 syringes of Radius on the first visit. And then depending on, what the goal was, the second treatment, we would need maybe half of that. But all in, and this is a national average because, I talked to people in Miami, I talked to people in Ohio, I talked to people in California, because we're all trying to get on the same page and playing field as, well, what do you charge for something like this?
Mm-hmm.
In Houston, we have a large Colombian community, if you will, and they love the booties, and so they'll pay the money for it. And I think the same thing is true in Miami, but they just really don't mind paying for that lift. So it's going to cost about $10,000 overall.
Mm-hmm.
Usually on the first visit, it's about $6,000, and that's at a really discounted rate if you know like the cost of fillers and what
and how much
we're
you have to
charged
use
for fillers as a provider.
Yeah.
You're really just charging kind of treatment time in a room.
Mm-hmm.
You don't really charge per syringe like you do when you're using a syringe on the lips, because obviously if you did 15 syringes at $750, it would just be astronomically expensive. So it's more of you charge a rate for your, and then you're really, the patient's getting the filler for pretty much cost.
Wow.
But that's what they need. And it lasts a long time and everybody's happy. So it kind of, I love my butt, and everyone that does their butt loves their butt. So.
Right.
The question is, does your husband love your butt?
Well, it's funny because my husband saw a picture of my butt on Instagram and said, "Oh my God, did you know I saw your ass all over Instagram today?" So he recognized my mole. And I'm like, first of all, how did you know he was your mole? I'm like, oh my God.
You know what? If he's looking at butts on Instagram, at least it's yours.
I will airbrush the mole out next time.
Sure.
I was trying to have legit medical photography and not alter the photo, but clearly I need to.
That's too funny.
It's great. And it lasts a long time. It lasts in myself about a year and a half. And then it's time, obviously to be retreated.
Oh, really? Okay.
So how does
it lasts? Once you get it in a good spot, and I only had 2 treatments. I've never, it's like the shoemaker that doesn't have any shoes or whatever. If I get 2 treatments in, like I'm a happy camper, and it'll last about a year and a half. And then I can always tell by how my butt looks in my bathing suit that, oh God, it's time.
Mm-hmm.
Okay. So on those retreats, what are we looking at on cost? Because I would think that just like with regular, filler in the face, it's always that initial treatment. People are totally deflated. You've got to kind of bring them back up to baseline. Is it the same with butts too?
Pretty much the same. Yeah. I mean, it depends on your goals, right? Some people want a half a syringe. Some people want 1.5 syringes in their lips. But depending on what we're trying to do, if you're trying to build someone that's, a size 0 that doesn't have any pop in their butt and they really want a bubble butt, let's just say it's probably going to be about $7,000 the first treatment. The second treatment, maybe $3,000, depending on what kind of, stimulation of collagen they get, how old they are, if they're a smoker, if they work out, if they're hydrated. I mean, all these things come into play, as far as how much of a collagen stimulation or biostimulation that they get. But it's about $10,000, $12,000 at the end of the day for your booty to look good, 1.5-ish.
And how does that compare to Brazilian butt lift, fat injections and stuff, the cost and the length, the duration of it?
Well, that's kind of interesting question, because I was a little surprised to find out, I was thinking that these were going to be more along $5,000 to $7,000, but kind of the average, I think a Brazilian butt lift is going to run with the surgery, the OR, the anesthesia, all that kind of thing, even post-care. It's going to run probably like somewhere between 10 and 15, depending on what part of the country you're in.
Mm-hmm.
So,
and duration of that, is that lifetime? Is that a few years?
Well, and again, that's going to depend on age and like skin quality and things like that. So it could be, 10 years, 15 years. It could be like 4.
And it depends on like how the fat's harvested, if it's taken care of during the harvest process. Is it viable fat that they're using?
Right.
I mean, if they're just lipoing different pockets of fat that isn't, that aren't good cells to begin with, 50% of those we know can potentially die out. So it's more of like a toss-up, I guess. But so no one really knows, I guess, how long those last. I think they're probably more semi-permanent than filler. But I think just some people just either don't have, like, I don't know, and maybe I'm tooting my own horn, or maybe I need to gain 20 pounds and then go get a Brazilian butt lift. I've thought about it, actually.
Yeah, we have talked about that.
I have enough fat to harvest.
Yeah,
so
some people don't.
Thing. Like,
what a
I
hard
would have
problem.
To put on probably 15 pounds. And here's the other thing.
Oh,
if you
when?
put on 15 pounds, no, but listen, if you put on 15 pounds, you have it transferred, and then you lose weight, what happens?
Right. That is true.
You know what I mean?
Yeah, totally. Well, and that's the big problem with fat harvesting period, whether it's in your face or in your butt or whatever. They only used to get like about a 50%. And so they would have to overfill it by right under 50%. Now they're getting, closer to like 66 to 70%, take of that fat grafting. That's basically what it is. It's a fat graft. So then again, they still have to overfill it in order to, get the result that they want. And that was a big problem with the Brazilian butt lift and overfilling the butt and then creating basically like a compartment syndrome of the ass to where, you have so much pressure in there, it damages nerves. So,
and just the time off work. I mean,
yeah.
I don't know, as a mom, as a working mom, I'm not sure that I could not sit down for 2 weeks.
Oh God, no.
Yeah, it sounds like a nightmare.
I mean, how do you, that just doesn't.
It
really,
is.
How does that logically make sense?
Oh, the patients that I've taken care of, I mean, they're only, 4 or 5 hours out of surgery, and they're already just miserable as can be. It's like horrid. I would never do it. However, with the non-surgical, I mean, that seems what's great about it. You don't have this issue with overfilling. You have you're putting in the filler, exactly the volume that you're wanting. You can pretty much see what you're doing, and you can, be conservative, and the patient can always come back. You don't have to, in order to get the right result or attempt to get the right result, you don't have to overdo it and hoping that it sticks. You just do it until they come back and until they don't want anymore. So I think that's a great positive aspect.
Real quick,
Uh-huh.
I'm looking at this website, and it says avoid sitting or laying down on your back for 2 months.
2 months.
For the fat graft onto the butt?
Yeah.
Holy cow.
Use BBL sitting for the first 2 months.
My back
Wear
would be so
compression
messed up.
garments for months 1 through 3.
Yeah, the compression garments for sure, too.
Biking, jogging, or running for 6 to 8 weeks.
Oh, wow. Okay, so tell us about the new cellulite treatment, Quo. It's spelled QWO, right? But it's pronounced Quo.
So drum roll, it is the first and only FDA-approved injectable for moderate to severe cellulite in the buttocks of women. But in my practice, we're also using it in legs. I don't know that the company wants me to say that, but I think you use medicines off-label all the time.
Cat's out of the bag now.
With it. So what it does is we inject it. It's an injectable, and we inject it. And we first do a consultation because, like I was talking about earlier, is it cellulite or is it laxity? So I think first of all we have to establish what is it that we're dealing with, and if it is true cellulite, then we can inject the cellulite dimple with Quo. And what it does is it treats the striae that holds down or tethers down and that causes that cellulite dimple. It destroys that. And so it pops, it releases that tissue to make it lay and look smoother. And so we inject it, and then we have to have them come back for a second treatment. But what it does is, there are 3 things that kind of can cause cellulite dimples. There's the skin that thins as we age, and then fat cells enlarge and push against that skin. And then there's fibrous bands or that septae that kind of pull and cause tension down through that fat layer. And so what we do is we inject it and it releases those bands, and it makes everything lay a lot smoother and look a lot nicer. And it's pretty darn successful. The next question I know you're going to ask me is, how long does it last? Is it permanent? Hell, I don't know. We don't know.
It's that new.
No,
when did it come out?
I don't know. So we got it in our hands. God, Anne, you're going to put me on the spot. I think it was the worst. It was really a bad time to launch because it was like July when people are already in their bathing suits. And you do get a lot of bruising with Quo. And I hate to say bruising because when you're injecting into an area full of red blood cells, what's going to happen? It's going to bruise.
Yeah.
Or I don't even know that it would be called bruising at that point, or it's just part of a treatment. But anyway, it was a bad time to kind of launch it seasonally appropriate, is in my opinion. But what because it does cause bruising for up to 3 weeks I've seen bruising, but there's no pain after the injections. It just, you get really bruised, and in about 3 weeks you start seeing results, and you need probably 2, sometimes 3 treatments. And literally we charge by the dimple.
Oh, you're kidding. Really?
Yeah.
What is it? 5 cents a dimple, $5 a dimple?
Yeah. It depends, right? No, the more you have, the cheaper it is. Just kidding. No, there's kind of industry standards as to what we charge, but I mean, it's not as much as a Brazilian butt lift might be. But I think that, the results that we're getting, it's obvious. The results are awesome. We start seeing them for sure in 10 weeks. It takes less. It's so fast. People are in and out of the office in 20 minutes.
Oh, yeah, that is fast. Cool.
Now, they say there's no downtime. Well, there is bruising, like bad bruising. And so I always tell patients, if you have somewhere to be in a month, I'm not injecting you with Quo, especially if they're a darker Fitzpatrick, because they're just going to be stuck with that dark hemocitrin staining.
Yeah. Okay, so kind of explain the difference, because I'm sure some people are thinking, well, why wouldn't I just go get Kybella or deoxycholic acid or something that's a fat dissolver to do mesotherapy?
Cellulite is not fat.
Right.
So that's the biggest difference is, you can eat well, you can work out, you can have a great fitness routine, you can have overall, wellness, but cellulite is not because you don't exercise enough or work out enough or eat the right things. But the things that, again, the 3 things that cause dimpling in the skin is that skin, the fat, and the fibrous bands. And those are typically genetic.
Yeah.
So,
well, I was so my question is, if you do dissolve some of the fat, wouldn't that take away some of the tension of the fibrous bands?
Right. But then you're going to end up with laxity. So then it's like, so you're replacing one ill with another, right?
Okay.
So now instead of a dimple, I have laxity, which looks and presents exactly like a dimple, right?
Yeah.
So now if I'm going to take fat away, then I'm going to have to fill it back up with something, or now I have kind of this double-edged sword. So instead of taking something away and then taking something away, we're just releasing what's causing the dimple in the mattress or whatever. Or I always think of I think they did a really good job on their ads when they had those puckers from, I guess, a button being pushed down a bunch of places on the butt, right? And so it makes sense just to clip those buttons off, and then wow, she's a really nice, smooth, firm butt. So I think taking fat away, I would be more. Before we had Quo, we filled a lot of dimples, and we did it fairly well. I would say 80%. Mm-hmm. But what you can't do, and I think Selfina, made a go at this too, and I didn't use Selfina, so I don't know, and I can't speak for them, so I'm not speaking for them. I think they tried to kind of, they came up with the idea of if we snip that septae or those fibrous bands, then we release them, and this is just another way. Instead of we inject them, then we release them. So it's just, we're instead of filling them, because you can't really fill them, you can kind of sort of fill them, and then we try to subcise them. I mean, and we've done it all right. I mean, so a little bit more subcision will make it look a little bit more smooth, but they were always left with that little bit of dimpling on top. So this just allows us to fine tune. And I'm not saying that I wouldn't go back over it even and do, Radius as like a volumizer on top to help with that skin integrity. But Quo really, I mean, I took a gal I saw last week, and I am going to plug myself but I haven't posted those pictures on my Instagram.
Go for it, girl.
My Instagram page yet, but we have a lot of butts on my Instagram page. Skin Descriptions by Melissa Gibbons. However, we took a patient who's in her 70s, you guys. So that means she's not going to respond to a lot, right? I always say, you're 70, you're not going to, respond a lot to a lot.
Yeah.
We took her from 18 dimples. Her second treatment, we only treated 8 dimples because 10 of those you could not even see. And we're rude in our assessments. I mean, we turned on the lights, we put on our cell phone, the light on your phone shining up, lights dimmed. I mean, it is like the dimple dungeon to see all the shadowing.
I love it. The dimple dungeon. I love it.
We took her from 18 to literally 8. And there was like 3 of us, butt level going, whoa, do you see anything else? Am I missing anything? And it was awesome. And she was like, no, I know it looks better. And I don't even stare at my own butt, but just passing myself in the mirror in the bathroom, I know it looks better. I'm like, who's that? My bathroom. Oh, that's me. So she did excellent. So it's like, if I can get a 70-year-old to do well with it, then I know my 20 and 30, 40-year-olds, they're going to rock out with it.
Oh, yeah, totally. That is incredible. Well, Missy, thank you so much. I've kept you long enough for sure. And you, again, like always, you're just a wealth of information. I love talking to you. I could talk to you forever. Like Sarah said, we
need to go on a trip soon or something for fun.
Oh, yeah. Our last trip was to tell everyone.
Where were we?
We drank so much wine, we forgot.
Wow, the buildup on that.
Oh, wait.
Cleveland.
Where were we in? Cleveland. I was going to say New Orleans. Cleveland.
No, we need to go to New Orleans. That would be awesome. All right, my dear, thank you so much. I really appreciate it. And I mean, just a wealth of information. I'm going to let Sarah wrap it up like she always does.
Okay, listen, people. Here's the deal. If you've made it this far in the episode, listening to us talk about butts for 30 minutes, then I need you to leave us a 5-star review and say, I was here for the butts. Let us know if you made it this far. But actually, for real, leave us a review and give us some feedback and tell us what you thought about this episode. Tell us what you think about butt injections in general, whether it's fat injections, filler injections, any kind of injections. How satisfied are you with your butt on a scale of 1 to 10? Let us know. And make sure that you follow us on Instagram, AestheticAnnRN, and also Facebook, AestheticAnnRN. And Missy, go ahead and tell us one more time, what is your social media? Plug yourself.
Skinscriptions by Melissa Gibbons.
So y'all go follow Missy. She is amazing. We're so grateful that she was a guest today. Thank you guys so much for listening, and we will see you guys in the next episode.
Bye.
Bye.